Nat King Cole says, unforgettable. And that's that program on WPRC, WLCN. That you hear each Wednesday morning, 0815 to 0900 hours. Viewpoint would be the name of the program. That program of politicians, perspectives, and personalities.
Well, and we have a personality. Well, we have two with us today, actually. And one will be 98 years young tomorrow. And that is my buddy Bill here. Now, I'll tell you what, Bill, I envy you, so I'm no spring chicken, but I'm a little younger than you are, but you are one sharp cookie.
I want to turn this on so my mother will get a recording of this. You're going to say something nice about him for a change?
God love you, Bill. Happy birthday tomorrow.
Yeah, thank you very much. We always try to start Viewpoint with a kudo or two, and it seems to be appropriate to me that with our guest this morning, that we think in terms of the service clubs here in Lincoln, Illinois, such as Kiwanis, Rotary, Zonta, and I don't want to skip over anybody else I should have said, and I apologize. Anyway, they do a lot of good in this community.
Yes, sir.
And the reason we're having our guest this morning is due to the way once she gets into the interview, if I ever get away from the microphone, I'm going to have it so she can introduce our guest. Zonta does a lot of things, and we'll let our guest expound upon that. So kudos to these service clubs that do good things in our community. Let's get right down to business.
Well, certainly. My equipment's on the fritz here. Yes, our guest today is representing the Zonta Club of Lincoln. It's the time... Whoops. I tell you what. Thank you, James.
The reason we're laughing, you two listeners out there wondering what's going on, Judy's microphone is not being very cooperative today.
It's thinking for itself.
Yeah.
Yes. Our guest is Dr. Susan Harmon, and she is a member of the Zonta Club of Lincoln. And that is what we are going to discuss, because it is once again time for their turkey dinner. That is their fundraising experience each year that supports all the programs that they support. So Dr. Harmon is with us today, and if you have any questions about turkey or Zonta or doctoring
or how many pounds of turkey
COVID,
they have to prepare for us. You know, in the old days before...
Or the price of turkey.
Yeah, oh boy, that's another story. The old days, before this COVID thing hit us, it was always a fun thing to do. As I recall, we had the turkey dinners at Carroll Catholic School, and there was something to look forward to. Everybody pitched in and worked hard, and I hope they always made a couple of bucks for Zonta, because they do a lot of good things in the community. But so let's get right out of the details first, Doctor. Let's talk about the day and how we want to get this tickets distributed so we can sell some tickets so they can do good in the community.
Well, thank you.
Doctor, pull that microphone forward just to go to bed. Thank you, dear.
You got it?
Yeah.
Is that good? They're all thinking
They
for
think
themselves
for themselves,
today.
don't they?
So, our turkey dinner is typically on the first Sunday of November. So this year would have been Sunday, November 7th, which is a week from this Sunday. However, due to supply chain issues, we are not going to be holding the turkey dinner in real life. We're going to be holding it virtually again for the second year in a row. Last year it was COVID restrictions. We couldn't have more than 50 people in a room.
Yeah.
This year we were looking forward to having our turkey dinner again at the high school, but we were unable to procure 58 turkeys for 1,000 people for Sunday, November 7th.
Isn't that interesting?
Oh, my.
All the turkeys they grow out here around Central Illinois, and they couldn't come up with enough.
Yeah, no, they could not promise that they would have it. So...
Well, are the turkeys having some kind of a scourge among them or something?
I don't know that. I think really it's that there's impediments in certain parts of the supply chain. So the farmers have turkeys, but the processing plants don't have workers, or the truckers can't truck them, and each layer adds another impediment to that.
It's all Biden's fault. Well, there went my job for the rest of the year. No, I wanted to throw that in because everybody blames the presidential office about everything, so we have to have a little levity about the thing. But seriously, this is just a local Zonta Club. You multiply that around all around the country. We have service organizations trying to raise money in their communities, and they run into problems. And this is not a small problem; it's a major problem.
Right, it is. I just came back from our Zonta is a worldwide organization to provide empowerment for women through service and advocacy. We're in 64 countries, but our international headquarters are in Oak Brook, Illinois. And a couple of weeks ago, we had our fall conference for our section, our district, which is Illinois, Wisconsin, and Indiana. And so all the clubs that met there were talking about the difficulties they were having with their fundraising, not being able to meet in person, so membership is dropping off, and so we're trying to work really hard to maintain enthusiasm and do what we can. So, and I know that people are very excited to help Zonta fundraise for our scholarship program, which has been going on since 1981. And that's why we do this every year, why we cook and bake and things for 4 or 5 days and then hopefully recover in one day and serve 1,000 people at the Lincoln Community High School. So
648-5510. Our guest this morning, Dr. Susan Harmon, not only a very nice lady, so you be real nice to her if you have a question, call, because you might meet her in the ER sometime, and she'd be in charge there. So seriously.
And she'd be doing good work when she's there, let me say this about that.
Just a side issue there. Is it, I want to kind of phrase this correctly, we're a small community. Is it unusual for a hospital this size to have an ER department that is staffed like we staff it here?
no, this is pretty typical.
Pretty typical.
Our hospital is able to be maintained because the federal government has identified it as a critical access hospital, and that way they get excuse me, they get support, because if
Take your time, we're not going anywhere.
if our hospital were not there, then people would be driving 45 minutes with their wife in labor, with their husband having a heart attack.
Right.
So you don't want to lose your small community hospitals.
Oh my.
And so it's 24 beds upstairs. Our ER is 11 beds, plus up to 4 in the hallway if we actually need them. And but yeah, the staffing is very typical. We have one doctor and one advanced practice professional, which is either a nurse practitioner or a physician's assistant who helps, and we are in charge of anything that walks or rolls through the door.
Well, we're extremely...
They come in, they're yours. That's
Yes.
just how it is. And then you, do you triage then from there?
Yeah, everything.
If that need be?
Yeah, everything is triaged by the charge nurse. So, unfortunately, if someone is less critical and someone is more critical, the less critical person, even though they got there first, might have to wait. And we're with the HIPAA laws, the privacy laws, we can't say, I'm having to take care of a heart attack in room 4.
Yeah.
I'll be there for your stitches as soon as I can.
Yeah.
And so...
Does that hamper you quite a bit?
That's just a fact of life. It's a fact of the job.
No. I don't mean the triaging, but the business of having to decide all day and all night, depending on your shift, that this is more critical than that.
No.
Time after time after time, or does it just become a
No,
way
that's
of
the
life?
training. That's the training. You go through 4 years of, 4 years of college, 4 years of medical school, 3 to 7 years of residency, depending on what your specialty is, and then you're out in practice. And even in a doctor's office, if they're seeing the well checks and the baby checks and the sore throats and things, and they have somebody who comes in and they're vomiting, or somebody that comes in and they're groaning in pain, they have to stop what they're doing and go take care of that person and make sure it's not life-threatening. And so that's all doctors, all medical practice.
I guess I'd be safe in saying to the listeners and so on, do we drive by a memorial on the highway there and just know it's there and kind of accept it and take it for granted? Or do we stop and think for a minute how lucky we are to have that medical facility in our community, especially with the ER department that we have here, because, people I know once in a while have to go to the ER.
Yeah.
and they get doggone good care there. One of the things that was discussed off air before we started this program this morning was one of the problems that Dr. Harmon will face daily, I guess, is trying to find beds for people who need a hospital bed. And it's not unusual for you to find somebody to go clear as far as Danville or Champaign.
Yes.
Am I correct in that, Doctor?
That is correct, yes. Particularly when we have the surges of COVID, the hospital bed situation becomes much worse, but it's odd right now because we're actually on a downturn. We just got over our 4th surge of COVID, so we're not having as many COVID patients in the ER, but we have everybody else. So we have pneumonia, urinary tract infections, heart attacks, appendicitis, and those people need hospital beds. And yesterday, Springfield had no beds, either hospital. Bloomington had no beds. Peoria had no beds. And these are for run-of-the-mill hospital beds, ICU, certain ICU beds. It's not like there are no beds. It's that they have to hold back a few for a stroke. A true heart attack that's going to have to go to the cath lab and get their artery opened up. So they have to save back a few beds for those things so that somebody doesn't die. And that means the appendicitis has to wait 4 hours or longer.
You just juggle all day and all night, don't
Yes,
you?
yes.
Judith and James and Doctor, we could sit here and talk medicine, and I enjoy this, but the real purpose of having Dr. Susan Harmon with us this morning is to talk about Zonta.
Yeah, and I want to ask you a question about your dinner. The thing that threw me is it's virtual again.
Now, how do you do that, Doctor?
Do that.
We do it on a GoFundMe, on the GoFundMe platform. So if we're going to start the real advertising campaign next week, but I wasn't available next Wednesday, so. The platform is open right now. So if you go on GoFundMe.org, then you just type in the search Zonta Club of Lincoln, and it comes up, the 57th annual Zonta Club Turkey Dinner.
57th.
Yes.
Bless you.
Yeah. Started in 65. Well, it started as a Zonta Zupper in 65. That was when it was on the second floor of the Knights of Columbus downtown.
Oh,
and
boy.
I was betting that, Bill, you knew about going to upstairs, the rickety stairs they talked about, going up to the Knights of Columbus, which is where Abe's Caramel Corn is now.
Yes. Oh, yeah.
So
And before that, it was John Kerrigan's funeral home.
Oh my goodness. So the other option for donating for our virtual turkey dinner is you can send checks to State Bank of Lincoln in care of the Zonta Club of Lincoln turkey dinner.
Some people might be a little bit not coward, but unsure of themselves in a Go For Me fund or whatever the name of the fund is. The nicest and the easiest, the quickest thing to do, the most expeditious thing, is write a check to Zonta and take it to where?
To the State Bank of Lincoln.
Well, you could do that between now and the time we get off. We'd like to have about 10 checks
Yeah, really. Really.
of substantial numbers.
Has the thrust of your philanthropy always been education?
Yes, that's been one of our major things. In 1981, Judy was our president of our club, and they started a health career scholarship. And the first recipient was Dr. Seeloff.
Is that right?
And the second recipient was Jan Berglund, who is now Jan Seeloff.
Yeah.
And
only a few of us know the history of that.
yes,
Yeah.
so, but we funded innumerable nurses who've come back to Lincoln to practice. Dr. Noby as the other one that I remember that we've done, but we've done different kinds of scholarships, business scholarships in certain years, women's scholarships in certain years, health career scholarships in certain years. The emphasis has adjusted a little bit, but we believe that we've given out over 100 scholarships for over $60,000.
That's a pile of money
Yeah.
and
so-
a pile of work.
Right here in Lincoln, Logan County.
Yeah.
Right, absolutely, yeah.
And
So,
that money stays within the community because that's its purpose.
right, yeah, the scholarships go to Logan County recipients. So,
That's part of your
648-5510. Now, Dr. Susan Harmon is our guest this morning. We're talking about how to eat turkeys virtually. I'm not sure. And I think Doctor will take us step by step through the medical process. Be nice to her. Dr. Susan Harmon, a very nice lady, and you might could be your fortune or misfortune to meet her in the ER sometime. So, cover yourself when you go to talk to her. Go ahead, Doctor.
we haven't yet decided, and if people want to put a vote out for the best dressing in the world, is the Zonta dressing at the Zonta Club of Lincoln turkey dinner.
And I bet that's a secret recipe.
Well, except that it's in the Zonta cookbook, so
It's
not exactly
a
secret
closely
anymore.
guarded
Yes.
secret.
But, it does have to be taste tested, and Pete Luckhart and Becky Worth were longtime dressing committee chair people. And so when we were making these steam vats of dressing, you would have to cook a little bit of it and make sure that the spices were correct. And
I see.
things.
Now, let me
So-
ask you a question here. Can we sell some cookbooks? Do you have any cookbooks
Nope.
available?
Nope. The cookbooks are, thank goodness, finally all sold.
So
But
just buy a virtual cookbook and take a check to the state bank. That'll
that's
take
right.
care of it.
Maybe if we said, if for certain levels of donation, I will personally send you a copy of the Zonta Club dressing recipe.
Oh, well.
How about that?
that-
How about for at a level of $25 or more?
Oh well, that's got cheaper than I thought. I was going to guess to see if we couldn't get $100 out of it.
But I have to ask this question because it's very practical. Now, when one gets the recipe, how many people does it feed? I mean, I don't have 1,000 people for Thanksgiving.
That one is in the notebook laminated. You're not going to get enough for 1,000 people. However, the original recipe that's in the cookbook fills 3 13-by-9 pans. However, I have cut it down to 1 13-by-9 pan, so you'll have your conversions for that.
That's pretty home friendly.
Yes.
Then. Yes.
But the other secret is that if you make the 3 13-by-9 pan, you can freeze it in quart or gallon bags before it's cooked, and it will be ready for you at an upcoming holiday for you to use, and you don't even have to make it again.
like Christmas.
Exactly.
Practical.
Pass me up. By the way, speaking of Christmas, we have a habit here of forgetting that we have sponsors. And that's not a Christmas gift, that's something they pay for. So we'll defer to them for just a few minutes, so we're going to get right back to Dr. Susan Harmon and the Zonta Virtual Eat Your Thanksgiving by Virtuosity. Good morning, right? Welcome back into the studio this morning here at WLCN, high on the hill here at Lazy Row. Program, of course, is Viewpoint each Wednesday morning at 08:15, 0900 hours. We try to work real hard, Judith, and I bring different guests in from different stratas of life. Today we have a lady who telling you how to cook Epicurean delights virtually. Dr. Susan Harmon is with us this morning, and the thrust of our guest this morning being here, it's to talk about the annual Zonta Turkey Dinner, which we find out in conversation with Doctor a while ago that getting supplies is not an easy thing. Dr. Harmon, let's take us through. It's okay to repeat a little bit about what we plan to do.
Okay, for the 57th annual Zonta Turkey Dinner here in Lincoln, because of the lack of supplies of turkeys, we are having it virtually again this year. And so if you would please give us a donation that would help us with our scholarship program. And all they have to do is go on GoFundMe.org, GoFundMe.org, and search Zonta Club of Lincoln, and it will pop up and you can give a donation, or you can write a check and send it to the State Bank of Lincoln here in Lincoln, Illinois, care of the Zonta Club of Lincoln.
Very well, and your money will be well spent, because you mentioned some of the people you had GoFunded me, and they are very valid, wonderful people. Thank you.
Mm-hmm.
Well, the big thing is the purpose of the turkey dinner, the purpose of Zonta here is raising scholarship money for kids in Lincoln, Logan County, and I can't find a better philanthropy than that. And it's not true that Doctor and I will offer you Bloody Marys if you get there by 10:30. But go to the bank. Take your time today, this very day, Wednesday, October 27th, and find time to write a check. Make it a little bigger than you would normally write a check for, and take it to the State Bank of Lincoln and mark it for the Zonta Club. It'll be a good thing you did, and you'll feel good about that. This has been going on how long, Dr. Harmon?
The turkey dinner's been going on. This will be our 57th year.
That's incredible to believe.
And the COVID has been going on for how long?
57 years.
Well, now we talked about this business off air a little bit, and I was kind of surprised to find that almost on a daily basis you find somebody with a COVID situation. Am I correct in saying that, Doctor?
Yes, that's very, very correct. More than one patient. It's
see.
I'd like. Pardon my ignorance, but I live with it every day.
Don't look at me when you say that.
No, I was looking at me. Can you define COVID for me, please? I've heard that word 700 million times, but I'm not a doctor and I don't know.
Okay. COVID is, the CO part of it is corona. That's the family of virus. That's the V. I, that's the VI is virus. D is disease. So COVID is a coronavirus disease.
Acronym.
Dash 19 means that the first case showed up in 2019. That's what it means. It doesn't mean that there are 19 coronaviruses. It means that it came to be and was identified in 2019.
And the major symptoms of COVID are?
Respiratory. So cough, fever, shortness of breath. Up to 30 to 40% of the people lose taste and smell or have a change in their taste and smell. So all of the temperature checks only maybe less than a third of the people actually have a fever with it. Some people just feel like they might just have allergies. And then when the Delta variant came around a few months back, it had more GI symptoms. So we would have vomiting and diarrhea. So it just makes everyone miserable.
Now, how did that virus variety itself evolve?
We don't really know, and that's part of the problem with that the public, all of us are going through science in real time with this virus and the pandemic. Science takes time to figure out what's causing what and where something came from and what's the best treatment and all of those things. But if you're present on day one, it seems like everyone's just fumbling until they come up with an answer on day 365. But that's always been the case, is that everybody, with smallpox, with polio, you guys were around in the polio epidemics,
yes.
When the Salk virus came out first, and then it had some problems, so the Sabin came out first and Salk came out second. But everybody didn't lose faith in the medical community when one of the first vaccines wasn't as good as a subsequent vaccine. So it's frustrating for me as a medical professional that people are saying, well, since the doctors don't really know what's going on, I'm losing faith in medicine and they don't really know what's going on. As opposed to, we are learning in real time and we are getting out as much information as we can, the best way we can, to take care of people the best possible way.
Yes, but, we people have evolved too, and we're in the immediate gratification era. Everybody wants it, whatever it is, and they want it now. Mm-hmm. And I think that you're just caught in that.
Right. Well, it is human nature to want things to happen quicker. I myself remember getting sick one time and taking my first dose of antibiotic and having like 2 or 3 hours later going, how come I'm not feeling better yet? Yeah. And I'm like, because stupid, it's going to take a few days. Yeah. And so with all my training, it's still human nature to say, how come I'm not better yet after the first pill? Yeah. So, and unfortunately with COVID, until now, and I don't know much about the oral medication yet, there's not been a magic pill to get rid of it. And we don't know who is going to get really severe disease. When I take care of people in the ER, some of them come in and they're at the very beginning stages of it. They're on day 3 or day 4 of their acting like bronchitis or sinus infection or stuff, and I have to tell them they have COVID. And I have to say, I don't know if you're going to be one of the ones who in 4 days can't breathe, who in 4 days has an oxygen level that's supposed to be 95 is going to be 75. I can't predict it. My entire career has been being able to look at somebody and say, am I worried about this person? Am I not worried about this person? That's part of the training, part of the art of medicine. That's not present now because we don't know, other than the usual things like if they're diabetic, if they have asthma, if they have heart disease, those sorts of things. Of course, they're at higher risk. But these are young people in their 30s and 40s coming in. And I said, I'm sorry, I don't have any idea if you're going to be one of the ones who gets much worse and ends up back in here and I have to intubate him and put him on a ventilator.
Oofta, how hard for you? You're really taking a shot in the dark, aren't you?
Well, you are trained to take care of lots of different things and lots of critical people, and it's almost easier once they're very, very ill because you know what your steps are. It's like, okay, we're going to do this, and we're going to do this, and we're going to do this, and we're going to take care of you. And it's the uncertainty. I don't know what's going to happen, but I wish that people would be more confident in the vaccine and get the vaccine.
But let's talk a little bit about that, because there are lots of people out there who are saying, "Haha, not me, you're not getting me into that." And now, of course, the latest breaking medical news is about the vaccine for the little people.
Right.
And I'm sure that there are parents who are going to say, "I'm not subjecting my child to that." Mm-hmm. What do you say to somebody who's a skeptic?
Well, the problem, in my view, is that when you do your own research, when you're not medically trained, when you haven't had statistics and you haven't had to learn how to look at a study and say, these are the problems with this study, when you're doing your own research without that background training, everything looks like it's equally important. And on Facebook, everything looks like it is more important the louder they yell. And that's not the truth.
Yeah.
So
Exactly.
there's a very interesting piece of information. I'm in a Facebook group with over 80,000 other women physicians.
Oh my.
It's called the Physicians Moms Group. And you would not believe the number of physician mothers who have enrolled their children in the studies for these vaccines so that they can be approved in children. And I think that should let you know how comfortable female physicians are with giving these vaccines to their children.
You know, though, now just yesterday or the day before, there was a news item on the news, obviously, and they were talking about the little children that they're going to begin to vaccinate. And they said that actually the death rate and even the occurrence rate was so low in that group, statistical group, that they didn't advocate. So you get this from Fox News or whoever, and then you listen to you who knows what you're talking about.
Right. We take care of children, in our ER as well, but we're not at a children's hospital like in Springfield or Peoria or Chicago or St. Louis. So I don't see the numbers.
Uh-huh.
So when I've had children with COVID in the ER, I will call the pediatric intensivists at these centers and say, what do I need to look for? What do I need to do? And they said, really, the kids are doing pretty well with the COVID. They're not having big problems. But again, there are late problems that can occur with the kids in terms of it can attack their heart muscle.
So these are after the fact type things.
Yeah, toward the end of the course. They can have a multi-system inflammatory syndrome where it just attacks their own body, attacks the rest of their body, and they die. And and everybody goes, well, I don't, that one of the vaccines has a certain level of risk of myocarditis, which is that inflammation of the heart muscle. And they're like, well, I don't want to have that vaccine because I don't want to have that myocarditis. I don't want to have that heart muscle issue. Well, but the rate of it happening with the vaccine is much lower than it happens if you get the actual disease. But people don't think they're going to get the disease until they get the disease.
Right.
And I wish that we had testing sooner, because remember at the very beginning, the only test we had available in the United States wasn't accurate, And so we didn't have a test for like 2 or 3 months at the beginning. We just had to go based on our symptoms. So it put us behind the 8 ball for a long time.
Okay, yeah.
648-5510. Our guest this morning, Dr. Susan Harmon. We can take you to the doctor's office, or we can talk about Zonta and how to fix turkeys. The primary purpose is to have Dr. Harmon with us to stop and raise a little money for Zonta, because they spend the money right here in Lincoln, Logan County, in scholarship funds. And I don't know of a better philanthropy than spending money on kids' scholarships. So philosophically, I'm always inclined to really run for the Zonta. Not because they serve doggone good dinners, but it was a good way to spend your buck.
And dressing that you can expand to 3.
Yeah. But we've also spun off this thing. COVID business has transfixed almost everybody. Communicable disease is exactly what that is. Am I correct in that, Doctor?
Correct.
And in the old days, when I was a kid, that's a long time ago, the health doctor would come and tack a little red sign on your door: measles, mumps, whooping cough. That's all communicable diseases. But there are various strains of that. Some are very serious and some are not. So the bottom line is, Dr. Harmon showed up here at the studio this morning wearing her mask. Protocol would indicate that we should think more, all of us should think more about the other people. If we don't think about ourselves in protection, think about our fellow man and fellow lady out there who we might infect with our disease.
That's a very good point, Bill. And, you know, I think that Americans have kind of made fun of Japanese and Chinese wearing their masks. And, you know, they go around wearing their masks all the time, not just for illness issues, but because of air pollution issues. But we've gotten this negative connotation, I think, about wearing masks in public from our attitudes toward that. And now that we're asked to wear masks, it's become a personal statement of your independence, you know, to not wear a mask. But yeah, it is. You're wearing a mask so someone else doesn't get ill.
That's right.
And you have to wear it over your nose, please. And you have to not take it down to talk to people. And you have to not take it down to cough. All right?
Yeah, really.
All of these things have I seen. And so in the future, after the pandemic, there is an after the pandemic, at some point in the future, when then we get into flu season, you're going to see me wearing a mask when I am out.
For the same doggone
Correct. If I could encourage people to wear masks when they have a bronchitis, when they have a sinus infection, not so much, you know, so that you're not coughing your germs onto surfaces that then people are touching and then touching their face. It's not just the droplets, and then so that you're not spreading your germs. You know, so if I'm wearing a mask, it's because maybe I'm not feeling well and I'm thinking of you.
And that's showing a little bit of consideration and respect. 2 elements that are terribly lacking in our world.
Correct.
And let's think about somebody else, because we're all sharing the same space.
We get her certificate, Jim. Dr. Judith K. Busby. Doctor, at what age did you first start thinking of yourself as wanting to be a professional?
I was 9 years old when I wanted to be. I saw a program on PBS on a neurosurgeon, and I wanted to be. So I said I want to be a doctor. And this is back in the early 70s. And back then, girls didn't become doctors. Girls became nurses.
Yes.
And even my hometown doctor himself goes, you should grow up and be a nurse. And I go, I don't want to be a nurse. I want to be a doctor. And so then I I grew up in Taylorville, and I was a candy striper in junior high and high school, and back in the days when we had candy stripers. And then I became a certified nurse's assistant during summers from college. And I never changed my mind. I said, I want to work in the hospital so that I did my CNA job so that I didn't find out I was allergic to the soap and I couldn't do this job before I, accrued all the debt or whatever. But no, I've loved it my entire life. I'm unusual. Even in my medical school class, maybe only a quarter to a third went straight through. I was one of the youngest people in my class because I went straight through. So lots of people. I was just telling somebody the other day that the oldest person in our starting medical school at 42. A single mother of 3 teenagers starting medical school.
Boy,
She had exactly. So I was 28 before I had my office practice, and I was with Dr. Dennis Carroll and Dr. Ken Burge here in Lincoln at age 28 in 1991, and here I am 30 years later.
Well, we're sure happy
God
you hung your nurse's cap on the peg and went to the
Yeah,
up the register.
the nurses will tell you it's because I don't take orders well.
You give orders well,
I give orders
by
well, yes.
George.
The bottom line is, we're better off here because of your medical expertise.
Amen.
Amen to that, yes. Is it amen or amen? You Presbyterians do it differently.
We are different.
Oh, by the way, I want to make a quick comment. Mrs. Busby's daughter, Cynthia Bounds, had charge of the service at the First Pres Church last Sunday, and we went and attended, and I was proud of her. I said her in an email, said proud. So
Oh, bless her heart.
she did a fine job. So let's shout out for her. Dr. Susan Harmon has been with us. I'm going to give her a couple of minutes to close up because we're doggone clock keeps running around to 9 o'clock too fast. Doctor?
Thank you so much for having me here today. Again, the Zonta Club of Lincoln 57th annual turkey dinner is going to be virtual for the second year in a row, but please donate so that we can use our money for scholarships to Logan County residents, and also for certain service projects to help advance the status of women, domestic violence victims, and other pertinent service projects here in Lincoln. And if you would be so kind as give us a donation, you can go online to gofundme.org and search for Zonta Club of Lincoln and give us a donation that way, or send a check to the State Bank of Lincoln here in Lincoln, Illinois, care of the Zonta Club of Lincoln.
And for that, if you go to the emergency room, she'll give you a couple of APCs and mark you a duty.
Thank
Dr.
you
Susan
so
Harmon, we
much.
appreciate your presence with us this morning.
Thank you so much.
You're taking time out of your busy day, and they are each and every day. So thank you, Doctor, very much. Thank you for Viewpoint.